And so we're here at Hope Clinic today, waiting for the Secretary of Health, Mr. Javier Becerra, to arrive. He's here at Hope Clinic to promote Medicaid re-enrollment. As you know, after the end of the emergency health plan, people who have Medicaid are being disenrolled. They're getting in the mail letters saying they have to re-enroll in Medicaid. And for our community that's very diverse, Asian-speaking languages, sometimes it's hard to understand what that paper means. And it is very important that you check your mail and that you get re-enrolled. So this event is really to make sure the community is aware and ready to get re-enrolled. We have many partners today that can help you re-enroll in Medicaid. So if you don't have anything to do, come and check one of our partners to see what you need to do to make sure you don't lose Medicaid. It's very important not to lose your Medicaid because doing a reapplication can take many months and you can be left without insurance, especially for your children. So that's why the Secretary is here. Thank you.
Thank you, Miss Andre. Thank you, Doctor. Xin chào quý vị khán giả. Tôi tên là Lý Yến, là nhân viên cộng đồng tại phòng khám Hope. Hôm nay chúng tôi rất là vinh dự được đón tiếp ông Bộ trưởng Bộ Sức khỏe và Dân sinh của nước Mỹ chúng ta. Thì hôm nay ông tới với một cái mục đích rất là quan trọng, đó là như chúng ta được biết, qua 4 năm của Covid thì những người được Medicaid và CHIP đã được tự động giữ Medicaid và CHIP của mình. Tuy nhiên bây giờ mọi thứ đã trở lại như cũ và chúng ta có một cái mục đích, đó là muốn cho tất cả mọi người có thể giữ được Medicaid và CHIP của mình với một cách, đó là họ phải update lại, cập nhật lại những cái thông tin về thu nhập của họ, và nếu mà họ vẫn có thể qualify, tức là họ vẫn giữ được cái Medicaid và CHIP thì rất là tốt cho họ. Còn nếu không thì họ có thể đăng ký vào Marketplace, và điều quan trọng nhất đó là họ phải giữ được cái thông tin và cái kết nối với lại Medicaid và CHIP. Đó cũng là cái lý do mà ông Bộ trưởng đến ngày hôm nay tại phòng khám Hope. Xin cảm ơn. Dạ, xin chào quý vị khán giả đài Apple TV. Hôm nay Lý Yến, nhân viên cộng đồng tại phòng khám Hope, rất hân hạnh được mời đài Apple TV đến đây. Chúng tôi rất hân hạnh được đón tiếp ông Bộ trưởng Bộ Sức khỏe và Dân sinh của Mỹ Quốc. Và hôm nay chúng tôi có rất là nhiều khách mời tới đây là những community partner, và đồng thời hôm nay vì chúng tôi nói về Medicaid và CHIP Unwinding, tức là một cái chương trình mà như quý vị biết là Medicaid và CHIP đã có một cái sự mà tự động renew cho 4 năm đại dịch, và hiện giờ thì tất cả các gia đình chúng ta cần để ý tới những cái thư mà chúng ta nhận được ở nhà, và những cái thư mà chúng ta nhận được từ văn phòng của Medicaid và Medicare nhắc nhở chúng ta là phải cập nhật hồ sơ của mình, cập nhật về địa chỉ cũng như cập nhật về thu nhập của mình. Thì hôm nay chúng tôi rất hân hạnh được đón tiếp rất là nhiều những đơn vị mà có quan tâm về vấn đề này đến đây. Dự kiến là sẽ có từ 200 tới 300 khách mời đến đây ngày hôm nay, và chúng tôi rất là hân hạnh vì có thể tổ chức một cái buổi sự kiện như vậy tại phòng khám Hope, một cái đơn vị mà chúng tôi mới khánh thành năm nay, và một cái đơn vị mà chúng tôi mong ước sẽ có thêm nhiều bệnh nhân được chăm sóc hơn nữa tại phòng khám Hope Elip, trung tâm y tế Hope Elip. Xin cảm ơn. Kính thưa quý vị, xin được giới thiệu với quý vị, đây là ông Wilson Gomez. Ông sẽ có vài lời giới thiệu về cái phòng khám Hope tại Elip. Dạ, xin mời ông.
Hi, good morning. My name is Wilson Gomez. I'm the facilities manager for Hope Clinic. I'm very pleased to talk about our facility. It has 70,000 square feet of clinic space. We opened our doors in March of 25th of this year, providing services such as behavioral health, vision, pediatrics, adult clinic, dental, vision, and our new pharmacy as well.
Kính thưa quý vị, tên tôi là Wilson Gomez và tôi rất là hân hạnh là người đã chăm sóc cho cái tòa nhà này từ những ngày bắt đầu thành lập. Và xin được giới thiệu với quý vị, tại phòng khám này chúng tôi có hầu hết tất cả các khoa mà một phòng khám đơn giản có. Chúng tôi có khoa nhi, khoa răng, khoa mắt, và chúng tôi cũng có một nhà thuốc mới được thành lập và rất là mới và có thể phục vụ cho các chương trình bảo hiểm cũng như các chương trình discount cho bệnh nhân. Dạ, xin cảm ơn.
Your presence here is a testament to your commitment to diversity and inclusion. Thank you. to have all their immigration papers processed without problems. Your presence here means that you, as a representative of our government, stand with us and by us as we seek to provide the best medical care to our community. On a personal note, and as an immigrant from Bolivia, having you in this building is evidence that in this great nation of ours, our dreams can come true. Before we can hear from the Secretary, you will have some short remarks from Dr. Porza, our navigators in our communities. Dr. Porza is the CEO of Harris Health, a leader in our community, and I'll welcome to the podium to express a couple of thoughts on what the healthcare means for our community.
For this country, but specifically for the state of Texas. So Harris Health System is an example. Yes, we are the safety net hospital system for Harris County, something we're proud of. We have a statutory mandate to take care of the uninsured and underinsured, and that is very true. But we also, through our level 1 trauma center hospital, and top hospital, level 3 trauma center hospital, LBJ hospital, the busiest one in the state of Texas, we provide life-saving critical care to the entire community. In addition to that, in partnership with our medical schools, UT McGovern Medical School and Baylor College of Medicine, Harris Health System is where almost half of all the doctors who currently practice medicine in Harris County, City of Houston, got their training. Almost half of all the doctors. In addition to that, Harris Health System also happens to be a huge economic impact and economic engine for this community. For every dollar tax support that Harris Health System received last year, we returned to the community almost $6 in return. Last year alone, that was about $5 billion. 1 out of every 70 jobs in Harris County is directly or indirectly related to Harris Health System. So I mentioned those things just to emphasize the important role that the safety net hospitals provide in the community, duplicate our efforts. So I also want to thank Dr. Catacostas for her partnership, but also for her service as a member of our Board of Trustees. Secretary Becerra, thank you again for being here. I'm going to turn it back to you.
Care and have nowhere to go or don't know what to do, are in the middle of deciding of whether to continue paying their homes, paying their cars, deciding to buy groceries, or continuing with their children in the hospital. They have no more resources, financials, to get help. They are new to the country, or they have no family to lean on and are completely lost. So they do depend on community health centers like ours, like Harris County, and have low access even to transportation to get to the help they need. I have too many stories to tell, not enough time. But the help is very much needed everywhere. Not many people like to show that they need help. Not many people are, a lot of people are more than likely embarrassed to say, I need help. And it's because of centers like this that they are able to find it without having to feel embarrassed to do so. Thank you.
Our next speaker is Vanessa. Vanessa is also a single mom of 2 children.
My name is Vanessa Tovar. I guess I don't need a microphone. I want to thank Shane and everybody for coming, for giving me the opportunity to express the challenges that I faced while applying for Medicaid, while being pregnant, while getting a different job, incomes changing, and also renewing. I've faced the struggle of life. You know, going through life, you have a lot of inconveniences. I am not able to afford these expensive insurances, so therefore I asked for the help of Medicaid, and I am one of the lucky few that am very grateful to have it, and it has helped. However, enrolling for it could be difficult. The forms are good to submit and everything. However, whenever you are asked about income, it's before what you take home, you know, and we don't really have that to lean on. I have myself, I've had, you know, family members where they've been denied just because of $1.10 or a few dollars, you know. I have 2 children. I need the security of having Medicaid and that sort of blanket for myself and my children. You know, let's say I have a raise of 25 cents or $1, you know, you're really stuck in the middle because I might not get the benefits I need because I get a quarter extra now. You know, at the end of the year, at the end of the day, it does not make much of a difference because how can I pay for anything with it? But, you know, I appreciate that I at least know what I know to get through with it on the app, making phone calls, even though you may get distressed by getting transferred from department to department. It's a process emotionally, and you just really at the end of the day, we're like, man, I'm just trying to get my kids well child checked, you know? I just need a referral, or my son has to see a specialist for this. I'm very grateful that my children don't have any special needs, because I can only imagine how hard it would be for a single parent, mother or father.
Throughout his career, he has made a priority to ensure Americans have access to affordable health care they need to survive and thrive. And you know, he has many years of public service. You can certainly read his bio online, but I know that I am the one standing between you and him. So please welcome to the podium.
To Dr. Borson, all the work that he and his team do to make sure that those in Harris County have an opportunity to get the coverage they deserve. You know, we have to stop talking about healthcare as a privilege. Healthcare is a right. Although it's not, right? It's not in our Constitution, it's not in our state laws. Clearly in Texas, the state with the largest number of uninsured Americans, water that's clean that you could drink. When it's hot like this, you expect that the electricity will be there so you can, if you have a fan or an air conditioner or cooling, you can turn it on. When it gets cold, you expect that you'll get the utility you need to turn on the heat. When your child turns 5, you expect that you can send them to a decent public school. That's because that's a right. Your children have a right to be in school. You have a right to drink potable water. Why is it that we all of a sudden stop and say, you don't have a right to health care? I've never quite understood that. And we're going to fight to make sure that even if, that's what this is all about. And so when you hear Trina talk about the work that she's doing to try to help people stay covered on Medicaid, and if not Medicaid, maybe CHIP for the kids. If not Medicaid or CHIP, then maybe the marketplace under Obamacare. And if not that, by the way, if you're employed, maybe your employer has a policy, a plan that you can take. One way or the other, we got to find it. Because in America today, under President Biden, there are more Americans who have health insurance coverage and can go to a doctor or a hospital than ever in the history of this country. And President Biden does not want to put it in R, in reverse. He wants to put it in D, drive and move forward. And so that's why we're working so hard with all the states, all 50 states, with the tribal territory and the territorial governments to try to make sure that we maintain that level of record numbers of Americans who have access to health care. And by the way, Obamacare, the marketplace, record numbers of Americans today have their insurance coverage through Obamacare. 16.5 million. And probably going to grow because some of those Medicaid recipients will likely have to migrate over to the marketplace. But I want to tell you why we broke records. Because we didn't wait for folks to come to us. We did what Trina did. We went to where they were. And we talked to them because we knew we probably could connect them. And guess what? The reason we broke a record, it got to 16.5 million, virtually a 50% increase from the previous administration in the number of Americans who have coverage under Obamacare, because we saw a 50% increase in the number of Black Americans who signed up for Obamacare. We saw a 50% increase in the number of Latinos who signed up for Obamacare. We saw a 30% increase in the number of Asian Americans. They wouldn't have to worry. And a lot of those folks who are on Medicaid now who are losing it wouldn't have to worry if you all had expanded Medicaid. And so we're just going to keep working. We're not going to give up. That's the president's order. And so we're going to follow it. And I hope you will help us. I hope you will help Trina. I hope you understand that we've got a job. We cannot let anyone forget to update their information to the state Medicaid agency and then therefore end up getting dropped because they didn't give updated information. We got to make sure everyone opens their mail, because people stop opening the mail from Medicaid because they didn't have to worry, because they were told, don't worry, you don't have to reapply. That's what you're supposed to do every year, right? But during the healthcare emergency, they didn't have to do that. Now they do. They have to open the mail. They have to apply. They have to give the right information. If they move, they have to let the state Medicaid agency know that they're no longer at the old place. And so that when they send out the information to the old place and it never gets to you, you get dropped. And that's what we're seeing too often. Procedural issues are denying people health care. We can't do that. So we need your help to make sure people understand they have to respond. They have to update their information. And please, as you heard from Ai and Vanessa, and I think Trina, you mentioned as well, children, just because you as an adult may not qualify for Medicaid anymore, doesn't mean your children will not. There's a strong, strong chance that most of the children will qualify for some form of health care. Medicaid, CHIP, Marketplace. We got to try. That's our job. Because everyone in America should have peace of mind when it comes to health care for themselves or their children. And so I'm here because you gave me a good reason to get out of hot and muggy Washington, D.C. But then again, I got to Houston, and what did I find? Hotter and muggier, Houston. But it's still great to be here because you do some phenomenal work. Dr. Caracostes, I want to say thank you, and I see one of the champions of Houston who just walked in, Congresswoman Sheila Jackson-Lee. So I'm finding the perfect time to hand it back over to Dr. Caracostes.
Thank you again, Secretary, for being here and sharing your thoughts and your commitment to our community. We're very grateful for those words. I want to let